Here at Total Wine & More, our amazing selection means you'll always
love what you find.
Dad? What are you doing here?
Just getting a sneak peek at my Father's Day gifts.
Well, I was thinking of getting you this Barrel Select bourbon.
That's a really nice bottle.
And Total Wine has it at the totally lowest price.
Wow. You always were my favorite.
Thanks, Dad.
Talking to the bourbon, sweetie.
Love what you find. Like the perfect gift for Dad at the perfect price. Only at Total Wine & More.
And drink responsibly. B21.
Ladies, we are here for you. It's episode 8 of the Dare to Ask podcast. This is part 2. Prescription? Love all the feelings.
Be kind to yourself. Some days we're going to fail because we're all human.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Stopping ourselves and choosing a different path is how we actually create change.
So the brain, it's so good. We needed to bring back Dr. Bess Martin for a part 2 this season. She's rocking her specialty in neuropsychology and is a clinical psychologist, and I get a chance to go deeper with her. We are going to start dissecting more emotions, like anger. It's important, and it can be mislabeled at times as sadness or something else. So we're going to talk deeply about how change and normalizing our emotions is possible. She also breaks down the number one way to manage anxiety. This is research-backed. It's number one. It is so easy and so free. I think you're going to love it. And Dr. Martin gives a metaphor that might be my favorite way to explain coping strategies and how also to change them to something healthier. Her metaphor game, it is off the charts good. And we're going to cover Midwesterners and even very specifically rural culture and the mountain it can be for those suffering from depression and needing help but not being raised to ask for it. So let's get into it. Dr. Bess Martin now. Growing up where I did on a farm and ranch, that culture has its own thing as well. And in the Midwest, that mantra, that life motto of I'm okay, just ignore anything going on with me. I'm just going to focus on this. And yeah, unfortunately, you raise your children to be very gender specific too. And it's like, well, back to boys should have this emotion, girls should have all of these emotions, and let's not cross, and let's not. And unfortunately, that's still happening. I mean, we're still raising our kids that way, or some people are. I think that I've seen a lot of progress. Just being able to look back and share with my parents, this was something that you guys had done, and I'm choosing consciously not to, let's say it's discipline this way, or just, choosing a different path. And it's really wonderful to see them be so much more open-minded, and say, I wish we would have thought of this, or I wish we would have done this way. So that's, it's good. It's always nice to see some progress. But since we're on this specific page, I know that this has become like a huge thing for the amount of like depression in middle-aged to later-aged men specifically. And we're in the Midwest, so a lot of cultural, like white males, it falls into this, I'm really hurting in some way. And the hurt is, let's say it is a chronic depression or something that's really wrong, but I can't find the way to ask for help. What do you think about that? How do we break through? Because if I'm a woman who's listening right now and going, oh my gosh, this sounds so much like my dad or my uncle or my grandpa or my brother, what is the right way to intervene and help?
Yeah, well, and I think that kind of varies depending on the person that you know and love.
Of course.
Right? Because not everybody is going to be able to hear, like, I think you're depressed. Or I think you're anxious. Because those words are not, they don't mean anything, right?
Right.
And research has shown us it doesn't actually matter what we call our emotions so long as we label them correctly. You can call them Billy, Bob, and Sue if you want. As long as you're consistent and you name them appropriately, you can kind of manage them better. And so adapting to the language that's used, right? So, you know, sometimes I see people who they may have an episode of anxiety and they're like, oh, my heart is acting up. So if you can identify the thing that's causing anxiety and address that, you may notice that their heart calms down. Right. And, you know, if it is somebody who would be open to, like, do you think that you might be anxious or nervous or stressed or worried? By all means, this is where I'm not Midwestern. I'm very direct.
Yeah.
My poor family, they put up with a lot from me just being like, I think this is going on. This is what's happening.
Yeah.
It serves me well in my professional life, so I'll stick with it. But I think that there's ways to do that in a, like, sensitive and probably more functional approach.
Yes.
Right? Like, I think, as we are aging, my current I'm an elder millennial myself, and as we are aging, having those difficult conversations with our parents, and feeling that reciprocated, like you say, in some areas, it takes time, and sometimes you have to have that hard conversation more than once.
Yeah.
Like, I just heard my dad. I went to visit them in March, and my dad was saying, you know, I would have never heard my dad even say he loved me. And, like, so when I first hear you guys, like, criticize or, like, talk about the way you were raised, and I think it was so much better than the way I was raised. And then, you know, like, recognizing that these conversations aren't necessarily about, like, saying, shame on you, you did a bad job.
Yeah.
But instead saying, like, look at us getting better generation by generation, and, like, the improvements. And I'm so glad you broke the patterns of, you know, that my dad did tell me he loved me, you know, and, like, I'm really grateful that he was able to do that. Yeah. But it's hard for him to talk about still because he wasn't raised that way, and it's a struggle. And so finding the ways that he can talk about it, and also recognizing, you know, if somebody's gonna say they're sad, take it seriously.
Yeah.
Like,
I think even more so if it's somebody that doesn't normally identify emotions.
Right.
Like, to me, that'd be like, okay, that was a large red flag. I'm gonna, it's good. It's good. I'm going to be there for them. I'm going to be supportive in whatever way I can.
I don't always advocate that it's always us as women's work to, like, help solve problems. I think that's one of those things that's been kind of an ongoing thing, right? Like, we are the emotional nurses for all the men in our existence. And I'm not an advocate of that necessarily, but also recognizing, like I was talking about, anger as an acceptable emotion. I've worked with a lot of men of all ages who, with a little bit of time, can learn to, like, note the anger and then ask what's driving it. Because sometimes it's the sadness that's pushing the anger, or the fear is what's driving the anger. But anger is what's going to come out. And so when we can start to recognize that, then it's not always anger for anger's sake. And not to say anger doesn't have a place, because anger does have I love all emotions. And anger is important. We need it. That's how anger happens, like, I think righteous anger, right?
Yeah.
It happens in the face of injustice.
Yeah.
Nothing in this world would change or get better if we didn't have a little anger.
Yeah.
If we didn't, like, face injustice or unfair situations with a bit of anger, nothing would change, really. It's a very motivating and kind of driving emotion. And so, like, give space and acknowledge the usefulness of someone's anger in an attempt to create change, maybe. But recognize it has a lot of destructive power, as does joy or happiness, right?
Right. I mean, if you're chasing that, it can oftentimes be a demise in many ways.
Right.
You know?
If that's the only acceptable expression of emotion there as well, it's going to get in your way.
Yeah, that is so true. I like the way you break things down. It's easy to receive. I can see why your patients, like, I'm going to need to come back to Dr. Martin again. She makes it easy for me to talk about this. I like the just the simplicity behind normalizing talking about it. If you can be someone's in their space, you've created an environment that means I'm accepting of hearing about your emotions. And this oftentimes is what helps us change, not only as our people, but, you know, the people we love around us, showing like, it's okay, I'm talking about this.
Yeah.
You know, and I guess what I've learned through life is it is usually the really bad stuff that can be that motivator for change if you decide to use it in that way. Like, okay, this thing happened to me, but it doesn't define me. And how do I find good in it?
Yeah.
But that can be a hard mental practice.
It can be. And some things are just bad.
Yeah.
People are amazing and resilient, and they do good despite bad. But some situations, I'm comfortable with some of that negativity. And like, for some people who may listen to this, it can be really hard to hear like this was on purpose, or this can be good. Some things are just bad, and they are what they are. That doesn't mean all of life is ruined by it.
Right.
But that thing might just always be bad.
Yeah.
And that's part of life, in a like kind of a downer way. But I think it can be motivating for change for a lot of people. This is why we love good inspirational stories. Seeing people overcome is so...
Of course.
Right.
Yeah.
But I'm constantly amazed at people's resiliency, not only like emotionally, but like even neurologically. What the brain can recover from is, you tap into my nerd and you ask who I am. I'm a nerd.
And maybe it better if I just say, no, there is bad. There's evil. There's not good. There's really crummy things that happen in life and on this planet. And there's you know, oftentimes we can't change because then we put this expectation on ourselves of like, I have to make this change. And what if I don't want to like
dampen your sentiment,
not at all.
Because I think that great time to think about like renewal or change or like new beginnings, right? We think, and so thinking about like taking the opportunity to like embrace change, particularly for people who've practiced Lent, right? You've been kind of like practicing abstaining and then like transitioning into like, what am I going to take from this change practice that I've been doing?
Yeah.
Am I just going to jump back into life the way it was before, or am I going to like apply this long standing?
What's the hard thing for you? You have all the right tools in the toolbox. You've got all of the knowledge about the right coping mechanisms. What's your challenge? Today's day one.
Yeah. I mean, I think I don't have just one. I have lots of things.
Wait, because you're a human being?
Yeah, as it turns out. You know, I have to manage my anxiety day to day as well. It means that I have some good coping strategies and I have some what we might call maladaptive coping strategies, right? So I have some...
Define that for me.
So we all have ways of coping that are adaptive. They're good. They're helpful. They're healthy, right? So like for anxiety, deep breathing. I don't care who you are. People push back on me. It does not matter who you are. Deep breathing is the #1 research-validated, most effective way to manage anxiety.
Mic drop.
So sometimes it's that. Sometimes it's cookies. Cookies are maladaptive coping. I know it.
Yeah.
I had a fellow psychologist. We had a bad day together during COVID, and I went and bought cookies. Yeah. And I went around and shared cookies with everybody to like brighten our day. And she said, my maladaptive coping sees yours, and I appreciate it. And I think of that often because... Sometimes we need some of those. And I think that it manifests a lot when we talk about like self-care, right? So that's really popular.
It is. Buzzword that we'd like to slap self-care on everything.
And it's wonderful, but we mix the adaptive self-care and the maladaptive together into a giant pot, right? Man, I love binge watching a TV show too. And how is that working with my anxiety? It's good avoidance, right?
Right.
When I am living in the world of some TV show, I don't have to deal with my day-to-day problems.
Yep.
However, if instead I actually cared for myself, maybe I'd get off the couch and do my dishes.
Right.
So that it didn't stress me out every time I walked into the room.
Yes.
Mop the floor. I have 2 dogs and it is mud city out there.
Yeah.
There are things that like actually doing the care for ourselves, as is in the title of self-care, is more adaptive frequently than the things that we like to slap self-care on.
Right.
Like, I'm going to eat those cookies and I'm going to watch 12 hours of television.
Or I have to go get my nails done and that's self-care. Or I have to have a massage or a facial and that's self-care. Gosh, the way you just explained that is so, I identify so hard. Like, no, I want to sit here and watch my 100th crime show.
Right.
And just sit and I do actually very much recognize how much I need that downtime, that completely, it's just me. I've basically shut off. But then I see the massive benefit of, however, I'm so stressed by a messy house.
Yes.
And I then go into this, okay, I have energy. I can do this right now. I should do this right now. But I'm paralyzed by just simply not doing it. So instead, I'll turn something that was a self-care thing into probably something negative, because then I'll dive back into another 5 episodes.
And it doesn't mean that it can't be both. I'm not going to say that there's never space in our life for binge watching a show. I think sometimes that is what we need. Or getting your nails done. Right. You know, let's not work in a world of absolutes, right?
Absolutely.
Right? A lot of life happens in that middle space. Recognizing, stopping ourselves and choosing a different path is how we actually create change. I'll share with you my favorite brain metaphor.
Please.
So, as a neuropsychologist, we often think about how we create change in our brain. When we want to change, we have to make new pathways in our brain. So all those old habits, like getting home from work and turning on the TV or grabbing, I don't know why I'm obsessed with cookies today. I don't eat as many cookies. Like, it's a lot of sweets. It's not just cookies. I also love candy. Yeah. So it could be anything, but I'm using cookies as my example today. Now I'm going to have to buy cookies.
I know. We've talked about it so much.
I know,
like, if there isn't a cookie in your future,
right?
I don't know.
It's going to be a sad day. We have these, I call them like superhighways, right? So in our brain, those coping strategies that we go to without even thinking about it, those automatic responses are like superhighways, right? So sometimes you're halfway through a bowl of macaroni and cheese when you're like, I am stress eating, right?
Yep, before it clicks.
Because that is a superhighway for you, right? And that can be anything. So that can be our emotional response to a situation. That can be turning to alcohol or substances instead of turning on the TV. Whatever our coping thing is, it becomes, the more often we do it, that neural pathway through our brain from like this to that gets so strong, because every time you do it, you're like beating that path down, right? So these are super highways that exist. And some of them are laid down in childhood when we say that I should be cleaner. One, it's really freeing to let go of that idea. It doesn't actually matter. We all live in our houses. Like, it should be sanitary for good reason. But like, it does not always have to be guest ready if you don't want it
or
to
magazine perfect.
Or magazine. It doesn't have to look like Instagram or Pinterest, right? I digress. So we have these superhighways. When we want to create change, the first time we choose to do it differently, it's like beating a path through the jungle instead of taking that superhighway, right? But every time you see yourself getting on the highway and you say, no, I'm going to take this exit, I'm going to take this little path I just hacked, it turns into a footpath. And then it turns into maybe like a fire road and then a gravel road, right? It just keeps going and going. The more frequently you take that path, the more well-traveled it becomes, and it turns into its own superhighway. And I like that one because it's how it feels sometimes.
I love that metaphor.
As well as how I'm a nerd, I already warned you. I can see the neurons firing when I talk about it. Yeah, it's hard work to create change. It starts right at that beginning. As soon as you recognize you're on the highway, you got to jump off.
Yep.
And make that choice. And I think some days when we're well rested and the kids have behaved and you've had your coffee or you've eaten all your meals and you've got the energy, it's easy to say, I'm going to do the dishes. I'm going to jump off this super highway. It gets really hard when you've been up half the night or had a hard day at work to make that choice. And be kind to yourself. Some days we're going to fail because we're all human.
This just in, we are all human. The reserve, the willpower, if you will. So let's say, okay, here's the superhighway I don't want to be on. I've started this beaten path down this one. I want to turn that into something. But let's say it really did add up. It was one of those days and your limits were being tested. Do you believe in we're only given so much willpower in a day? What's your position on that?
I haven't thought about it in the terms of like willpower.
Okay.
I will say that I talk about executive functioning. So you may have heard about this. I see it popping up on social media, which makes me nervous when terms we use in a specific way start getting used really broadly. But let's not keep it to ourselves then. So when I talk about executive functioning, this is often a lot of that heavy work is done by our frontal lobes. So this is why teenagers are bad at it, right? Willpower is a huge part of this. I think of it as the CEO of our brain, kind of, right? Okay. So she is in charge of assigning tasks and making sure that everything is done in an orderly and right manner. She's the thing that says, don't say that. Don't say that to a stranger, right? It puts our guard up. Our defenses and our executive functioning are all firing good when well-fed, well-rested, and when there's not a lot of tasks to do. As soon as you have, that poor CEO is managing work and house cleaning and shopping and children and
maintaining
poor health care, maintaining relationships, feeling the burden of all the things, particularly that are put on women. We talk about the like extra work that women do in a home and managing the schedule. All of those things are taking up space in your mind, right?
Yes.
This is when your attention starts to get frazzled because your CEO, executive functioning, does not have the resources to send to impulse control or to attention or to like, don't say that. We use it when we need to, right? So you might find when you've had one of those really hard days, you can still be polite at the grocery store. But when you're with your spouse or at home where you're comfortable and that guard comes down because you're like, I don't need you right now, executive functioning. You can put your resources to making sure the schedule's okay. I don't need you to watch my mouth. I'm in a safe place. This is when we're a real jerk, right? We are never crueler or ruder to anyone than we are to our family. Also super normal. I think we shame ourselves a lot for that. That's because we're comfortable and our filter is a little weaker and it's kind of a sign of love. But I mean, be nice to your family. I know. Be kind to yourself.
I mean, because I love you.
Happens.
Right. Yeah.
I'm too tired to do that. So I don't know if that kind of answered your question.
It really did. That was very helpful.
Okay.
Very helpful. Thank you.
Yeah.
We could literally stay here for another hour.
Yeah.
Dr. Bess Martin, you are such a treat and a wealth of knowledge. All the women vibes from you. And thank you so much for coming in and doing this with me.
Thank you. Yeah, no, it's been a pleasure. I always like to talk about all the things I'm passionate about. So
grab that nerd brain of yours and power yourself onto the next. And best of luck in your next endeavors too. When you crack open the books again.
Okay.
Dr. Martin, in part 2 of Prescription Love All the Feelings. She's such a treat to have with us. Next week, we're going to shift gears and talk kids, very specifically pediatrics, and we're going in with a cardiologist. So peds cardiology is what we'll be speaking on with a returning guest on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
At Wendy's, we make breakfast better. Like with our Breakfast Baconator. Better from top to bottom bun. Savory sausage patty? Better. Crispy oven baked bacon? Better. Fresh cracked egg? Better. The Breakfast Baconator might just be the greatest breakfast sandwich of all time. So you can keep settling for not better, or you can get a better breakfast from Wendy's. Tough choice. Choose wisely. Choose Wendy's Better Breakfast.
Participating U.S. Wendy's during breakfast hours. Hitting U.S. Wendy's during breakfast hours. Hitting U.S. Wendy's during breakfast hours. Hitting U.S.